Dr. Jake Dodds here, one of the NUCCA chiropractors at the Upper Cervical Chiropractic Group, and we're going to be talking a little bit more about sciatica. And sciatica is simply referring to the pain that starts in the low back, travels through the buttocks, and down into that low leg. It can feel like a lot of things. It can feel like a burning, it can feel like a numbness or uncomfortable, but when it follows that pathway, that's when we're talking about sciatica. Now, sciatica is referring to the sciatic nerve, which is the longest nerve of the entire body, and it starts in the back, travels through the buttocks, and goes down into the leg. Now, because it's so long, it can be affected in a lot of different ways and in a lot of different areas. The most common place that it's effective is in the low back or in the buttocks area. So in the low back, if there's a lot of stress there, a couple different things can happen. Something like a disc herniation can actually protrude the disc into the nerve and cause that irritation down that entire pathway. Or if you have extra bone growth there due to extra stress that's accumulated over time in that area, that too can affect the nerve and send those sensations down the back of the leg and be very uncomfortable for people. Another common area that it's restricted or irritated in is in the muscles of the buttocks as everything is continuing down into the leg. So if those muscles are pulling really tight or stretched or torqued over that muscle, it can irritate that over time and again produce those uncomfortable sensations as it's heading down the leg. And there's a variety of different things you can do to investigate to try to alleviate this kind of pain. So a lot of things to look at sometimes is changing your daily habits or doing some exercises, or in severe cases they may even look to a little bit more towards surgery. So these are all options, and one thing I'd urge you to consider is chiropractic care. So what we're looking at from a lot of people is that they'll come in and there's a lot of stress in the low back, their hips are tilted and twisted, and that's going to affect a lot of different things. So like we talked about, if you have a lot of stress in the low back area, that can affect those nerves as they're coming out of your back. And again, if your hips are tilted and torqued as you're moving throughout your day, it's going to be pulling all those muscles asymmetrically, and that can again start to irritate the nerve. So if it isn't something that you've considered before, or if it's something you maybe thought about but wasn't really sure if it would be a good fit for you, I really urge you to give me a call. We can talk more about it and see if it could be something that could potentially help you.